All right, everybody. Chris is going to be talking today. We're doing wrestling and skin infections because it's timely. But this is definitely, again, one of those FAQ heavy topics. So I will make sure to have this one saved to the YouTube page in case you want to refer back to it. We come across a lot of questions. In the practice questions, they ask a lot about herpes treatment for initial versus a recurrent outbreak. That's something they love to ask. I did not get asked that on my CAQs. I did get asked about molluscum, which I thought was the oddest thing off the whole list you could have picked. But again, it's CAQs. They like to do that. So I will let Chris take over, and I think we're all set. Thanks for your time, Chris.
Yeah, thanks, Suze. Well, good morning, everyone. I think at least half the fellows know me pretty well. Chris Tangen, I'm one of the sports attendings. I was taking care of Kent State, and sadly, you guys aren't going to be able to do that kind of D1 stuff, but you guys have plenty to cover. And Suze and I were talking earlier that finally we made it to week 10 of the high school football season. So I think with that, we're transitioning, whether your team has playoffs or not, to the indoor winter season, and I think that's kind of better because of the weather stinking here in Ohio. But with the indoor stuff can come more contact and skin stuff. So I myself am a former wrestler, so that's why I always like talking about wrestling and skin infections. So the information here on this talk is from Suze's slides from a long time ago, so I'm stealing from her, but then also these three sort of sports skin articles from the last handful of years. And the way I kind of run through it is just talking about skin lesions in general, then concentrating on fungal ones because in general they're a little more simple. And then the viral and bacterial ones are the ones where the athletic trainers and the other folks and coaches sometimes reach out to us more panicked as far as what to do with their wrestlers or their athletes. So that's kind of how we're gonna run this. And at the end, we'll talk about skin checks and what you guys need to do. And I'll talk a little bit later, but just a quick note, if you guys are ever covering something when it comes to wrestling, there's smartphones and FaceTime and stuff like that. Feel free to reach out to me sort of anytime. So if you guys have like a wrestling tournament and skin checks or something, just let me know maybe the day before that you head out there. If you kind of have any skin questions, I'll be ready to help you out. But our learning objectives here: identify and name the skin lesions, and then talk about fungal, viral, and bacterial skin infections, and then also return to wrestling guidelines. They're slightly different from the NCAA to the high school level, so we'll kind of discuss those as well. As far as why skin infections are important, sometimes it ruins an entire state high school wrestling season. And I think in Ohio at the high school state championship a few years ago, COVID kind of messes with my memory as far as when this happened. But I want to say it was within the past 6 years or so. There was like a bulletin sent out to everybody saying you need to be cleared by a dermatologist. I think that's kind of gone away by now, and us in the primary care sports world can clear these skin lesions. But there was a moment where the OHSAA was talking about dermatologists only clearing skin lesions. So that's why I think this is kind of an important thing where sometimes even the state high school boards try to change rules on who can clear athletes from a skin perspective because of outbreaks that happen at the state level. But when it comes to describing skin lesions, a lot of times it's whether they're flat or raised and then how big they are. So macules are less than a centimeter diameter and are flat. Another flat lesion is a patch, and that's greater than a centimeter. Papules and plaques are going to be slightly raised. So a papule is going to be less than a centimeter, and a plaque is going to be greater than a centimeter. And then vesicles or pustules, again, are less than a centimeter, and bullae are the larger ones, greater, a lot of times with burns, greater than a centimeter. And then nodules are going to be the harder indurated lesions, like sebaceous cysts. And then wheals are going to be our sort of hives, slightly raised urticarial lesions. So where do our athletes get infections? A lot of times from their teammates. But in the wrestling world, you're always practicing. And again, I'm a former wrestler, so this comes secondhand to me, but you're always practicing on a mat and usually in a very warm room. So you can sweat more and lose a little bit more of that water weight. So wrestling rooms are probably the best place in the world to grow bacteria and viruses from a skin infection standpoint. So that's why if you are a lot of times more often at the college level being asked to kind of recommend something about the wrestling room, it's going to be cleaning every day. And a lot of times at the college level, when I was helping out at Kent State, we would clean that twice a day, or I'd recommend they clean it twice a day. But basically, it needs to be disinfected, and there's a lot of products that your teams can buy. But if kind of all else fails, bleach and water with a 1 to 10 ratio is going to be really helpful to kill bugs. Equipment and clothing, so obviously not wearing dirty clothes and making sure all the clothes are laundered. Uh, and then locker rooms are another common source. So sometimes, again, at the college level, more often when the team's really using the locker room, we would do they called it a bomb, where basically they um, uh, aerosolized some disinfectants in the entire locker room just to kill all the bugs. And then training rooms sometimes are a source, but I think the athletic trainers that we work with nowadays do a really good job cleaning their training rooms. Transmission, mainly in our wrestlers, but our obviously contact sports, including football, is skin to skin very often. And when something goes equipment to skin, it's a fomite transmission. And again, that can come from their headgear, from towels, clothes, so on and so forth. Again, the worst place in the world is a warm, moist environment like a wrestling room. But the other thing that we think about is, when do these skin infections usually happen? Well, sometimes they always happen at the worst possible time, like right before a conference tournament or right before the state tournament. But often, I think what you'll see with your wrestling team is that these skin infections will happen right in the beginning of the season. Everyone comes in kind of fat and happy, and then they need to lose their 20 or 30 pounds to get to their weight class. That's a time where they're not drinking enough water. Their skin is really dry. They're getting cuts and lacerations at practice. So that's when you're going to really want to keep a close eye, probably right now, kind of as wrestling practice is starting. And poor hygiene. So recommend showering after practices. So as far as the infections that we're going to talk about, this is a slide kind of from the NCAA level, and if you can see the slide more closely, this is from several years ago. But as we'll see throughout the presentation, these percentages usually stay about the same as far as herpes or viral infections being more common in college and bacterial being more common at the high school level. Okay, so these are just a couple things from the more recent article that I pulled out, but basically showing that at the high school level, bacterial infections are more common than viral infections. Fungal infections are the second most common in high school athletes. And then there's a tournament in Fargo, North Dakota that is the national tournament for freestyle and Greco for the youth wrestlers in the United States. And they showed that healthcare providers overestimated bacterial infections. So I think the points here are, when you're covering your high school team, maybe think about bacterial infections first if you get a picture from your athletic trainer. But if you are covering college wrestling, a lot of times it's going to be herpes that they'll reach out to you for. And I think that's for a couple different reasons. Usually, the college wrestlers that I've worked with kind of know when they're getting a bacterial infection, and they'll put Bactroban, or they'll put bacitracin on there just to try to stop a bacterial infection. But herpes is what they can't stop without a medication, so that's when they'll reach out to their athletic trainer. And usually, when they get to the college level, they're a little more savvy about that. So I think that's one of the things that you may see with the teams that you cover. This is a look sort of from the athletic training point of view. And to summarize really quickly, viral infections are higher than bacterial in collegiate wrestlers, and viral infections, again, are also higher than fungal infections at the college level. Same thing if wrestlers getting a little bit of ringworm, a lot of times they'll just jump on top of that really quick with some Lamisil or some clotrimazole. Not important here, but this just the numbers of what was seen by the college athletic trainers. And then this took a look at college and high school, and it was sort of a reporting system. So there wasn't a lot of data that came from this study. But about the 100 high schools that reported, there was only about 11 colleges that reported. Again, same type of summary that in high school, bacterial skin infections are more common than viral. At college, herpes infections are more common than bacterial. All right, so we'll break down. I think fungal are sort of the easy ones. The maybe the tricky thing, kind of from your standpoint, is it just eczema or is it fungal? What should you do? Should you put steroids on it, which obviously isn't going to help the fungal infection, or should you put antifungals on, which isn't going to help the eczema? So I think in general, with your wrestlers, you're going to tell them, hey, listen, you're not drinking usually enough water. You're sweating so much. Maybe you are doing a good job of showering, but you are still getting some things on your skin. Make sure you're moisturizing all the time. It sounds a little weird talking to a wrestler, but I think if you tell them just to use lotion, that's probably the best thing. And most wrestlers will say, yeah, I'm doing that. But surprisingly, a lot of skin infections that I'll see in the clinic, they don't do that. So for these fungal infections, it's a tinea infection. Usually you're going to get those raised circular borders with a central clearing in the middle. And again, a lot of your wrestlers and athletic trainers are going to be savvy, but if this does get to you, you're going to have them do topical treatment for 3 days in a row before they can return to wrestling. And if it's on their scalp, they cannot return for at least 14 days. So if there's some tinea capitis that you see, there you may need oral medications, oral antifungals, but they cannot return for 2 weeks if it's on their scalp. I think there was a wrestler from Cleveland Heights, maybe last year, that had this situation and they kind of out of the postseason because it was in their scalp. So more on tinea, whether it's capitis or corporis. The tonsurins is the leading cause in the United States. I think I saw something recently that 90% of tinea capitis was this organism, but then there's a few others that you may see on the skin, or sometimes with wrestlers, it's gladitorum or gladiator, and we'll hear that when it comes to herpes as well, that word. But these dermatophytes infect the dead outside keratin level of the skin. And again, you'll see that scaly, red, itchy plaque that has those raised borders, and it's ring shaped, and there's some central clearing, sometimes hair loss as well. So a handful of pictures, I think coming up here in a second. Uh, Largely the diagnosis for a lot of these infections is clinical. You could do a fungal culture if you really weren't sure. But again, if you were back and forth between eczema or, gosh, is this fungal? I would start with just telling everyone to use lotion in general and then using the antifungal and not just saying one or the other. So Lotrimin and clotrimazole are really common over the counter. Most folks can pick that up or have their parents pick that up over the counter. So that's the first thing that you should try with this. If it's tinea capitis, you're going to think about PO medications and consider checking LFTs if you're going to do a long course. I think later on we'll talk about the length of the course. Jock itch, I saw this actually from the urgent care standpoint recently, and I think a lot of times athletes will treat this with every antifungal they can find, and sometimes this could be an eczema reaction as well. But if it is a fungal reaction, there is no clearance considerations because obviously everyone is covering their midsections, but this can be very bothersome too. So topical antifungals for jock itch. Again, a couple weeks of treatment, but there's no clearance considerations because everyone's covering this. Your athletes could try to wear more loose clothing. Sometimes in the wrestling world, that's sort of hard to do. But over-the-counter anti-itch powders or steroid creams sometimes can help if there is an eczema relationship to this. Tinea versicolor is another thing that we're going to sometimes see. I think I've seen it a few times, and it'll happen again in wrestling with the excess heat or humidity. This is not something that if you do make the diagnosis that there's any clearance considerations. As far as treatment for tinea or this is what tinea versicolor looks like usually on the trunk. Sort of these lighter hypopigmented lesions here, here, and here. But sometimes like the Selsun Blue selenium sulfide shampoo topically can be used. Some folks in the past have said you should take a shower and then as you're drying off, then put the shampoo on, sort of a better way to get to the fungus. You could use topical ketoconazole cream or shampoo. That's what's commonly prescribed from a clinic standpoint, or ketoconazole by mouth can be helpful as well. And again, if you make this diagnosis, there's no clearance considerations. So as far as the fungal infections, for tinea capitis, or when it's in the scalp, you're going to consider PO medications, and the duration is usually a few months. So sometimes I just tell folks, hey, listen, you're going to be on these medicines for gosh, at least 2 or 3 months. Even if it's starting to clear up, that's great, but you can't wrestle for 2 weeks after starting the pills. And then you can add the Selsun Blue, the selenium sulfide shampoo as well, but these are the PO agents. And again, you may want to check LFTs before starting this on your athletes. So griseofulvin is the most common one, but Lamisil, PO is also used. Failed topical treatment of tinea corporis or ringworm infections. So what listed here is fluconazole 150 milligrams weekly for 3 weeks. I'll actually just use fluconazole 100 milligrams, and I'll give the athlete 2 pills. I'll tell them to keep on using the topical clotrimazole or the topical treatment that they're already using. Take one fluconazole pill now, and then wait 1 week and take another one. And that usually does the trick for the wrestlers that I've done that for in the past. So this says for 3 weeks, I usually get away with, as long as they're using the topical treatment, 2 pills of fluconazole 100 milligrams. And then as far as clearance, again, for some of the fungal infections, there's no restrictions. So if this is on their feet, no restrictions. But if it's on their scalp or tinea capitis, oral antifungals for 14 days. That's at the first column is NCAA, the second column is high school. And then as far as ringworm on the body, they need to be on topical antifungals for 3 days in a row. And then the lesions should be covered when they wrestle. So that's when obviously the athletic trainers can help out with covering the lesions. So that was fungal infections. And again, I think the take homes for fungal are get on it soon. Wrestlers are usually pretty savvy and coaches are pretty savvy. If you're in between eczema versus tinea, I would say lotion and do the antifungals. And then if the antifungal topical isn't doing the trick, you can consider 2 diflucan pills of 100 milligrams each at a week apart from each other. So again, fungal. Now we'll talk about viral. Just before the talk, we were talking about molluscum, and I was saying that I hadn't really seen it until just a couple days ago. So this is something that kind of looks concerning, and when you first take a look at it, you're going to see that dimpling in the center of the dome, and that's more conclusive of molluscum from a clinical diagnosis as opposed to other skin lesions. That you can just cover. You could curettage the lesions if you wanted to, but overall, as long as you cover them, there's no restrictions for contact sports. Herpes, though, is the one that's going to be more concerning, and largely you cannot be cleared until there's all the lesions are scabbed over, there's no oozing, and definitely no new lesions for 2 days. So this is the one that your athletic trainers are really going to reach out for you, again, more often at the college level. So to talk about molluscum, it's pox virus. Uh, it may be itchy, may be red and concerning, and you're not sure if it's bacterial or not. So a lot of times you'll treat this, but if you see that dome with the dimpling in it, that's more of a sign of the molluscum. It usually hands, forearms, face, and trunk. I think I saw it on the athlete's knee the other day. But these are just other pictures of molluscum. And again, some of these scab lesions are because it's itchy and the athletes are scratching. Sometimes there could be a super infection, so it's not the worst idea in the world to try antibiotics, but largely the treatment is just cover the lesions and then they can wrestle. So from an NCAA level, they could be removed or they could be treated, but as long as they're covered. And then from a high school level, they should be covered as if they're going to bleed, like if they're open and someone's wrestling. So that's why they need to be covered. Spend a little bit of time with herpes here because this is the thing that you are going to be reached out to probably most commonly. Herpes simplex virus 1 is more common, but 2 is coming into play. For herpes gladitorum, a lot of times there's this prodromal symptoms that they'll feel, whether it's tingling, burning, itching, and you've sort of seen this probably in your residency days. And if not, you've probably seen it with shingles. But there's, a week incubation period. So sometimes you'll feel things a few days before the skin lesions actually happen. They're usually very painful vesicles on an erythematous base. So if you see grouped vesicles or pustules on a red base, it's very commonly herpes. They can evolve into ulcers and then plaques. Sometimes you'll have fevers, sore throat, headaches, and then you'll take a look and there's other skin lesions as well. I think I've had that once or twice recently in the urgent care where someone thinks it's a headache, but turns out to be shingles. So if there's a primary infection, it lasts about 10 days. So that's why Suze was talking earlier about the duration of treatment. If it's a recurrent infection, a lot of times your immune system is a little more used to it. Even if you need antivirals, it's just a shorter course. So if someone comes to you with a pretty a slam dunk herpes infection, and then you're definitely going to treat them for 7 to 10 days. A lot of times, from a recurrent standpoint, it's 5 to 7 days, a little less duration, but they still cannot participate until, and we'll talk about the duration of the treatment, but until there's no new lesions for 2 days. In the dermatomes, because a lot of times these viral infections will follow a certain dermatome, you have to watch out if there's any eye involvement, and that's when you're going to get ophthalmology involved. One of the high school administrators that I work with had this, and it was very close to his eye. I think he saw ophthalmology twice a week for like 2 or 3 weeks in a row just to make sure it didn't spread to his eye. So if this happens in your athlete, just make sure to reach out to ophthalmology to get them evaluated sooner than later, just to make sure there's nothing going on and they would lose their vision. Here are some oral lesions that we're going to think about. Sometimes we think about cold sores versus herpes. So again, a lot of these lesions have that red base with the grouped vesicles on top. And then just more pictures kind of from the left to your right are the how it progresses. So the red base, group vesicles, then sometimes the healing and scabbing that you'll see. And then at the far right is when they're nice and healed over, no new lesions, no bleeding. The incident of this in wrestling is about 30%. It leads to a lot of lost practice time, a lot of times for the wrestlers or the partner that they've been drilling with. And then again, it's usually skin to skin, not usually coming from the mats themselves. So that's why we'll talk later, but you might want to take your wrestler out like for sure if you're concerned about herpes and not let them. A lot of college coaches are pretty aware of this, but it's kind of annoying depending on how important that team member is. So sometimes I've had a few borderline arguments with coaches about, hey, when can this wrestler return? He needs to get back in the wrestling room, stuff like that. Let's see here. Abrasive skin clothing can worsen this. This is just something I saw in the literature about should military screen for herpes, and the article just said, yeah, I think it's a good idea. So I was wondering if we should screen our wrestlers, and a lot of times the coaches or your athletic trainers won't do it. They'll just take it by case basis. So I don't think you need to do. I wouldn't recommend that at your schools that you take care of that you do any kind of specific herpes screening before the season. These are just some other little atypical presentations of the of herpes skin lesions. And the diagnosis, there are viral cultures, but largely it's a clinical diagnosis. And again, you're going to want to get the antivirals on board as soon as you can. So acyclovir or valcyclovir, I think a lot of times we learn that the Valtrex 3 times a day for 7 days or 10 days is the treatment for these lesions. A lot of times with the wrestlers, they're used to acyclovir. So at the college level, we would just have huge uh, um, pill bottles full of acyclovir if needed. But again, you're going to want to get the treatment on board in the first couple days. So if your athletic trainers reach out to you, whatever your process is, whether it's calling in a script or going to Epic and punching in an antiviral prescription as soon as you can is a great idea. These are the treatments, dosages for the initial infections, usually for those 7 to 10 days, and then the recurrent infections, 5 to 7 days. So when I was the team doc at Kent State, we would do acyclovir 400 milligrams 3 times a day. That was for recurrent or new treatment, recurrent or new herpes, and we would do a treatment duration of 5 to 10 days. So a lot of times I would give them 30 pills and I would say, hey, listen, is this recurrent? Yeah, it is. Okay, take it for at least 5 days because that's what the requirement is for antiviral treatment, and then see if you have any new lesions. And then you can make a decision after that. With the recurrent lesions, they tend to go away in the 5 to 7 days. So I wouldn't necessarily tell someone to take 10 days no matter what, unless it was an initial infection. So to summarize this slide, I think a lot of times we think about Valtrex, but at the college level, I just go to acyclovir for the wrestlers, and it's 400 milligrams 3 times a day, 5 to 10 days. Yeah, so if someone does get diagnosed with herpes, the risk of transmitting this to one of their teammates is pretty high. It's up to 30%. So you're going to want to consider having the other athlete kind of take a look at his own skin to make sure he doesn't have any lesions. And then I think only one time, one year, there was a lot of outbreaks, and the coach was wondering about just treating everybody in the team, whether they had herpes or not, with antivirals. I think that season we decided against it, but it's not the worst idea in the world. And if you do that, you're going to screen LFTs before you start everyone on antivirals. I think a reasonable thing to do is either acyclovir 400 milligrams once a day or Valtrex 500 milligrams once a day. The article I read said 1,000 milligrams once a day. I don't think that's necessary, but it's reasonable if you want to follow the literature. I've had success with the wrestlers that have had herpes in the past that want to be on it, 400 milligrams a day. Another viral infection that we'll run into a lot of times, I've seen this in our women's soccer players, is warts on their feet. And that's the most commonplace, the warm, moist environments, but you can see warts in other places. Sometimes with wrestlers, it does seem like maybe an abrasion or something, as you can see here on the hands, but it turns out to be a viral wart infection. Generally low risk of transmission. These sometimes do resolve on their own. The body fights it off pretty nicely. But if you have access to a derm clinic, a lot of times your liquid nitrogen spray can be helpful here. So we've done that a couple times for the athletes that we help out with. Get them in with derm for the cryotherapy. So this is the what you can see on the feet sometimes. Sometimes it's painful because you'll pare it down, maybe with a scalpel, or the athlete themselves will. I've seen some athletic trainers even do it, and then it just becomes irritated. And you can imagine if you're running around all day long and you have warts on your feet, it can be bothersome. So if you see warts in your wrestler, they just need to keep them covered. And you can do treatment such as liquid nitrogen if you have a dermatology friend. You can pare them down if you would like to in the training room. And then there are some over-the-counter things. I haven't had success with over-the-counter. It's either liquid nitrogen with dermatology, or you can pare it down yourself and keep it covered. So at the NCAA level, they just need to have a face mask if it's on their face. Otherwise, it can be easily covered by their athletic trainer. So as far as clearance, again, the first column is NCAA level. The second column is the high school level. Primary herpes simplex virus, they need to be on antivirals for 5 days and no new lesions for 72 hours for the college level, 48 hours for the high school level. And then antiviral treatment for the high school level, they say 10 to 14 days. So if you do have a high school wrestler, it's less common, but you're going to get them on antivirals for a longer period of time before they get back to wrestling with no new lesions. And at the college level, again, the duration is 5 days of antivirals and no new lesions for 3 days. So these are kind of tricky, but the skin form, if you are unfamiliar with it, usually has this guideline on it because this is the one that wrestlers become most anxious about, and they'll try to fudge the days. Hey, listen, can you backdate a prescription, or can you write down on the form that you started this antiviral a day earlier? So sometimes there's some gamesmanship, and I'll tell you what I do later on when we talk about skin forms. But with the long duration, if someone does have a herpes lesion, that's why the athletic trainers will reach out to you so urgently, because they kind of know that the wrestlers need to start their medicine right away. Again, with molluscum and warts, just keep them covered. Oh, and then at the high school level, if it's a recurrent HSV, that's 5 days duration. So to summarize the viral, a lot of the viral infections are just keep them covered, but the one that's going to be most concerning and probably the biggest thing in your college athletes is the herpes, and you're going to want to get them on antiviral treatment as soon as you can. Acyclovir 400 milligrams 3 times a day, or valcyclovir 1,000 milligrams 3 times a day for 7 to 10 days is a good treatment. I generally go to acyclovir. So with the bacterial infections, and then we'll transition to sort of skin clearance at the end, but bacterial infections, you guys have seen this a lot, but largely no oozing with the lesions, no new lesions in 2 days, and 3 days of oral antibiotics. It sounds like there's 3 days for this, 5 days for that, but when you get the skin form, it does outline all of that stuff for you. So again, bacterial lesions, antibiotics for 3 days, no new lesions for 2 days, and no oozing of the skin infection lesions. Folliculitis, staph, strep are more common. These things could turn into something more concerning, but if you see this and you see the other skin lesions that we talk about, a lot of times getting topical antibacterial agents on them right away is a good first line treatment if you're not sure exactly what's going on. But these are infections in the hair follicles, so it's easier to identify because it's usually related to either the beard or where someone has hair. For folliculitis, Keflex, if they're penallergic, you're going to consider azithromycin, or Bactrim is probably the one that we go to the most commonly. If someone is allergic to penicillin and Z-Pak and sulfa, clindamycin is a good idea as well. So hopefully your athletes don't have that many allergies like a lot of our adult patients if you do adult medicine, but try Keflex first and then consider Bactrim. And if those fail or there's some allergy concerns, clindamycin. Furuncles are often staph aureus, and these things are a little more concerning because they're that indurated lesion that we saw earlier. If there is an abscess, a lot of times, if you're comfortable, you can do an incision and drainage, and that is the treatment. But Bactrim is something that you can do a little more easily. And if the athlete is concerned about an incision and drainage, or you don't have the supplies, Bactrim is the antibiotic that you want to get on sooner than later. Impetigo is the honeycomb skin lesions, a lot of times near the mucous membranes. They do have a red base, so sometimes at first glance you could think this might be herpes, but again, that honey-colored crusting lesion is more common with this impetigo. You will see impetigo fairly commonly. Sometimes they can have some lymph nodes or fever. But again, usually around the mucous membranes. And with this, Bactroban topical is definitely the treatment. So a lot of wrestlers, especially at the college level, will have a tube of this already, and they'll put this on any kind of bacterial looking skin lesion or folliculitis. So topical Bactroban is what you go for impetigo, but have a low threshold to bring on top with some Keflex. And then again, if you're concerned for maybe could this turn into folliculitis, could this turn into MRSA, then you're going to have kind of a lower threshold for Bactrim or clindamycin. But just off to the left here, in general, if you have a contact sport athlete, think about Bactrim, think about clindamycin if you're concerned for MRSA. But topical Bactroban, Keflex usually does the job. For these more concerning things with cellulitis where it's spreading, that's a time where you're going to definitely use antibiotics. And MRSA, obviously, you're going to get Bactrim or clindamycin, or maybe even consider an ER visit for these athletes if you're really concerned about something spreading into their bloodstream or causing systemic symptoms. MRSA, we'll talk about it. You will run into this, but it's not ridiculously common. Again, most things respond really nicely to Keflex or topical Bactroban. These are just some risk factors, and I can send the slide here too. But with these MRSA lesions, this is sometimes you'll see that spider bite and the huge indurated lesion with the surrounding erythema. If these things do turn into MRSA or have an abscess, you can try to IND them, but again, antibiotics for sure is what you're going to want to do. This took a look at reporting MRSA, and they took a look over a couple years and saw that in the first year, there was a lot of MRSA seen at the college and high school level. But then I think as these athletic trainers learned a little bit more about identifying and making sure folks had good skin hygiene habits, it decreased the next year. They mainly saw this in reported MRSA lesions in football and wrestling. There was a lot seemingly identified in gymnastics and rugby, but it didn't have a good confidence interval. So football and wrestling are the two sports for MRSA. Again, skin infection protection. There's some topical foam that some college or even high school wrestlers use to provide an extra skin barrier. Those are reasonable to try with your athletes if you're concerned. Cleaning the mats, taking a shower after, and then using lotion and making sure their skin is moisturized are generally what you need, but here are some other tips. So MRSA, if it's not MRSA, you can use, again, Keflex or Bactroban, not necessarily to treat this, but to treat other bacterial skin infections. And then you're going to always kind of think about Bactrim or clindamycin. If they need the ER, I'm guessing the inpatient folks will think about vancomycin as well. So how long do you do this? Yeah, twice a day, 3 times a day, 4 times a day if you're using Keflex for 7 to 10 days. If you are thinking MRSA, you're going to go for a 10-day treatment. So with Bactrim, double strength twice a day for 10 days, clindamycin 3 times a day for 10 days, lots of stomach upset and GI side effects. So you're going to warn your athlete about that. As far as clearance, we sort of talked about this before, but basically it's antibiotics for 3 days, no new lesions for 2 days. At the bottom here are the reminder of the skin, the tinea infections, and that's going to be your antifungals topically for 3 days. If it's on the scalp, they need to be on oral treatment for 2 weeks, not 3 days. And then we already talked about the herpes clearance. It kind of depends. If it's a new lesion, you're going to have 5 days at the college level or 10 to 14 days at the high school level, and then no new lesions for a few days. Recurrent infections, it's still the 5 days for herpes, and then no new lesions. Other things that you might run into scabies, 24 hours after topical treatment, and conjunctivitis if you are going to use an antibiotic eye drop, just 24 hours after starting the eye drops, and then no eye discharge. All right, so those are the skin infections and the types. And the last little bit here, I'll kind of talk about skin clearance and give a couple examples, and then we can kind of talk about a couple of the sort of issues that I've run into in the past. But these skin checks are held in conjunction with the weigh-in process. So if you don't know anything about wrestling, it's sort of an odd looking thing that happens in the morning before a wrestling tournament. And if there's a multi-day wrestling tournament, maybe a Saturday, Sunday, or a Friday, Saturday, weigh-ins happen both days. So sometimes your athletic trainers might want you to be there for a couple days, even hours before the wrestling starts. Basically, what happens is the wrestlers and anyone that's wrestled for more than a year knows what to do. So if someone's trying to pretend like they don't know what to do, they know what to do. So if what they all do is they all line up by weight class or however the referees want to run it. They take their clothes off to the appropriate level, and then the skin check happens. So it's sort of hard to check to see this on Zoom, but someone will walk up to you like this with their arms out facing you, and then you look at basically every inch of skin that you can. If they have long hair, you can kind of pull their hair back, and then you do this with your fingers, and they know to turn around. So then you can look at their back, and then you can, because they're not facing you, you can tap them on the arm or something like that and say, hey, you look good. Sometimes the referees will want you to put a little marking on their hand to signify that they passed skin check. And then once they pass skin check, they move on to get their weight checked. And once they make weight, then they go run off and eat and drink what they want to. So it's something that happens before wrestling meets and wrestling tournaments. And if you're unfamiliar with the sport, it's very odd. But if you are doing skin checks, this is us several years ago at the University of Akron doing skin checks before one of the national tournaments, and they had to pass through skin checks here. So actually, myself and the athletic trainers just picked a lane on the track, and the wrestlers would line up and try to come through before they got their weight checked. So this is a huge example of something that you may see at one of your tournaments, but basically they really want to pass the skin check on the way through. So we'll talk about a couple examples here. This is the skin form that you need to have at the high school level and college level. So if you are covering skin checks at the high school level or college level, and someone says, "Oh, my doc said it was okay. This lesion here, yeah, I've been on the antibiotics for the right amount of time. It's totally fine," and they do not have this form, here's what I do. I just kind of say, hey, listen, man, you needed the skin form, and if they try to say we didn't know about that, I have a small high school, I didn't know about it, they should know. So there's no reason that a wrestling coach shouldn't know this. It is by far the rule. So if someone tries to pass this off on you without this skin form that you can see here on the slide, you probably shouldn't let them pass. I think you could make a clinical decision. So there was a wrestling tournament that I had at Beechwood High School last year, and someone from a very small school came through and clearly had a herpes lesion, but in his defense, it was clearing up. So I said, hey, listen, do you have the skin form? And he said no. And I said, well, you should have it. I brought the coach over. The coach argued with me. I let him yell at me for a couple minutes. And then I said, well, we need the form no matter what you say. And I said, hey, listen, how long are skin checks going to go for? And I think the answer was like another 20 minutes. So I said, okay, if you can get some doctor to sign off on this from your hometown and email it or text us or something like that, I'll consider passing you through skin check. He was from a small town. It was whatever, Saturday morning. He couldn't get in touch with anyone. We did not let him participate. So we basically stopped him from his postseason wrestling at the high school level because obviously, if you don't pass through sectionals, you don't make it to the next level. So, just an example of last year, I literally did not let a wrestler participate in the postseason because they did not have a skin form. If you want to try to clear somebody without this, I would say maybe don't do it if I'm giving you proper advice. But if you really did want to, feel free to call me and I'm happy to discuss this with you in real time if you're making a decision. But I've had other examples where wrestlers will try to hide something with tape. You can have them take the tape off to take a look, and they might say, no, my athletic trainer just put this on. I have a wrist injury. Say, no, you have to take it off. So don't let a wrestler try to fool you, which sometimes happens. They always cover their midsection. So if you're concerned about a lesion in their midsection, you're not going to be able to examine it. So if they have a lesion in their midsection, they always have that covered. But you can take a look at every other area of their skin.
Chris, can I pipe in for 1 second?
Yes, Suze.
What I always tell people too is you're also the treating physician a lot of times for skin. So if you start anybody on anything to treat their skin, you can get one of those forms easily online by typing in like OHSAA wrestling skin form. So it's worthwhile to print a couple off and have in your bag. So if you see any wrestlers in training room or in clinic and you're starting medication, you need to complete that form and document it and send it with them. And I always tell them, like, take a picture of the form, always have it on you. But at least if you have a picture, you've got a backup if you lose it. Because you don't want them to be in the situation where they don't have documentation for when you started the medication. Because as Chris mentioned, a lot of them are you have to have been on for a certain amount of time. And then I'd also tell you, like, if you're thinking about passing people through and it's questionable, obviously for herpes, you're going to be way more strict than if you're dealing with somebody who's got like a questionable ringworm that they have documentation for. So just remember there's certain things that, like Chris said, you're better off just following the rules and not passing them. But if there's something that's questionable when it comes down to something like herpes or staph, you're just going to hold them out and not risk it.
Yes.
Suze is actually more responsible than I am. So I was actually going to ask Chris if he had PDFs of the most up to date NCAA and OHSAA skin forms that he could email us because I'm
Yes.
lazier than Suze.
Yes, I will. I would love to.
Thanks, Chris. Love you.
Yeah, I love you too. Other common things that I literally have run through because I've done these for years and years and years, and being a former wrestler, I know a lot of these coaches, but sometimes what'll happen is a wrestler will come through and they'll give you this long song and dance about how it's eczema and it's not anything else and it's like clearly herpes. What I usually do in those cases is I kind of know something's up, but there's like 20 people that are waiting for you to clear them. I just tell that athlete to stand to the side because you're going to feel pressure of like 20 people needing to get skin checked while you're trying to have like a 5 minute discussion with this one athlete. So I tell him to stand to the side and not, run past me where it looks like he got cleared. So just keep an eye on him and then maybe grab an athletic trainer or something like that to kind of, help you out a little bit as you, think about it. But I've had that experience myself, even in the past couple of years where a wrestler's giving me this song and dance and I can't really process it right at the moment. So I tell him to just stand to the side. I clear the other 20 people that have no skin lesions and then I address sort of the problem person. If you're at a big tournament like this and there's someone like myself there that you want to send all the difficult things to, you can happily do that. I'd love to help out in that way. Or if you are that person that's the final decision, maybe you can have the athletic trainers sort of help clear and you get only the difficult ones. So those are some ways that I've dealt with some problem athletes. I think I've had some Division I All-Americans that I've taken out of national competitions, and I have had D1 head coaches scream at me, and I've had ER docs that are like, "Hey, I'm his father. I'm an ER attending in Kansas City. I know about medicine. I'm his father. You can't do this. If you stand by the skin form, and like as Sue said, it's bacterial or viral." I will have your back. I'm sure Susan Mandy will have your back for sure. And again, as Sue said, if it is one of those eczema versus tinea and you really can't make a decision, as long as you can have your athletic trainer completely cover it, I think that's super reasonable to let that wrestler participate. So that's kind of the skin clearance stuff. Yeah, I will get these forms to you guys or give you some links.
And I
Great.
will tell you, this was
Yeah.
a very long time ago in Beechwood. Chris and I were both there. Wrestling people still hear the answer no a lot better from a boy than they do from a girl. And even better from Chris because they do know him in the wrestling world. So if Chris is there and you need backup, bring him over because
Yes.
it makes a difference. Like I had a coach being a complete douche to me. I knew the kid couldn't wrestle. And Chris came over and was like, no, he can't wrestle. And the coach was like, oh, I'm like, fuck you.
Yeah, that crap shouldn't happen, but
It
I think it
does.
does in the wrestling world. So yes, I don't know every single coach in Northeast Ohio, but I know a great handful of them, and I'm always happy to be the bad guy. And usually, I can kind of talk to them. Um, yeah. Oh, and if you do have like a high school wrestler or a college wrestler that has a birthmark that kind of looks funny, I would do a skin form for them at the beginning of the year that they can take with them to every single tournament, or as Sue said, take a picture of it, because you don't want some, athletic trainer that doesn't understand at some random place to not clear them. So if you kind of know someone has something that looks concerning, I would do a skin form, even if it's not an infection. Here are some references, and then yeah, if you guys don't have my cell, Suze, please give it to them, and literally, please, like this is kind of my favorite sport, so please
You want to just put
contact
it
me
in the
if you are going
chat?
to do a skin check. Oh yeah,
You
yeah,
want
do
just
that.
throw it in the chat and then You know, I tell everybody like skin's wonderful because you can just snap a picture and send it. Just make sure if you're texting any pictures to Chris or one of us that there's nothing identifiable in there. You know, like you don't want to face of the kid because it's still technically, you know, protected health info. If it's a lesion on the face, then that always makes it a little bit harder. So, you know, if there's anything you can do for a close up, um, for sure think about it. And then the herpes in that V1 distribution, like Chris mentioned, they really need to see ophtho like acutely. That's not one where it's like, oh, just call ophtho, you'll get it in a couple of weeks, because people can lose their vision from herpes keratitis. So, you know, I always tell people that's one where you usually have to work behind the scenes to get them into ophtho fast by calling and trying to expedite care for those kids.
Yep. All
Great
right,
talk.
guys. Well, have a good rest of your Friday. Welcome to week 10 of the high school season, and I'm sure I'll see you guys around. Thank you.
All right, I'm gonna leave the talk open just for another minute so you guys have a chance to write down Chris's number before I shut it off. Thanks, Chris.